Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. We started to get too many questions lately regarding the basic or fundamental principles of the skin health and hair health. So one of the most common questions we have from our patients lately is that they ask, what's most important? Is it the hair health or the skin health? Okay, here is the point. The main issue, actually, we should keep in our mind that because the hair is the appendage of the skin or like an outgrowth of the skin, its fundamental need is a healthy skin. So we need to be sure that the skin is healthy. If the skin is healthy, the hair itself, hair follicle and hair shaft will be healthy as well. Think of it like this. Good and strong trees grow in a strong soil. The same idea is here.
Does taking good care of the scalp help hair grow faster?
And the other question we get is that if we look after our skin of the head better way, will the patients or will people have a better growth and healthy growth? Yes, of course. As it was answered in the previous question, the healthy and strong hair grow from the healthy skin. If the skin is healthy, if its blood flow is in good condition, if there are no infectious diseases like a fungus infection, or if there is no skin disorder like psoriasis or like seborrheic dermatitis, the growth of the hair follicles are much more rapid and fast, and of course the hair follicles are healthier.
Does scalp care stop hair loss?
Okay, and the other question we have from the patient is that if the health of the skin will be good, will it affect the hair loss or will it prevent the hair loss? So here is the point. One of the fundamental mechanisms of the hair loss, especially in men, is androgenetic alopecia. And one of its main mechanisms of the loss is that the skin blood flow all the time diminish. So the blood flow and nutrition to the hair follicles, to the upper layers of the skin is diminished. So it causes the thinning of the upper layer of the skin. We call it like miniaturization, atrophy of the skin. It affects the growth, and of course, when the hair falls out, the skin also becomes damaged.
Do the scalp massages we see on social media actually work?
There are many questions, or on Instagram, on social media, you start to see that people start to do the massage on the skin of the head, on the scalp. Does it help? Okay, here is the point. The massage, first of all, helps with the relaxation. It makes you feel really good, especially after the long and busy day. So, but the scientific point of this is that when you do the massage or gentle rubbing to the skin of the head, it helps the blood flow to improve. So you have a better blood flow across the skin of the head. So of course it helps. For example, after the hair transplant surgery, we advise the gentle massage, so it improves the blood flow and the healing and recovery goes much faster. When you do it on a healthy skin or the gentle massage, it also helps with the blood flow again, and it gives more nutrition and supply to your hair follicles.
When should individuals who have undergone a hair transplant begin scalp care? If scalp serums are to be used, which ones are suitable?
Connected to the questions before, especially our patients after the hair transplantation surgery ask us when they should start care of the skin of the head after hair transplantation surgery. The main point is that one of the fundamental principles of the skin care is that the substances or dermatologic or cosmetologic stuff that you use, they should be in touch with the skin. And we require the recovery of the skin of the head. For the donor area, it's on average 7 to 10 days, and for the transplanted area, it's around 10 to 14 days. So the hallmark, we say, as soon as the healing is completed and the scabs fall out, it's really safe to start using the dermatologic and stuff that are used to do the skin care after the hair transplantation surgery. As a summary, you can start doing the care of the skin of the head after the hair transplantation surgery around 10 to 14 days after the surgery. The hallmark should be when the scabs will be off of the head. And the most common question we also have from our patients, what type of serums or what do we advise as a skin care? Okay, it can be different. It depends on what type of the care we are talking about. If it's a medical care to improve the blood flow and to help the hair growth, we advise finasteride and minoxidil. It can be either the oral tablet form or it can be the topical form of finasteride, minoxidil, or dutasteride and minoxidil combinations. And again, we can start using them around 2 to 4 weeks after the hair transplantation surgery. If you have too much skin or scalp dryness after the hair transplantation surgery, we advise some softening or nourishing products like aloe vera, coconut oil to make this area softer and look better. And one of the main hair and skin care after the surgery in general for the healthy skin of the head and general health can be a PRP and mesotherapy treatments. The PRP and mesotherapy can be done around 2 to 4 weeks after the hair transplantation surgery, as mentioned earlier, after the healing is completed and scalps will be off of the head. One of the advices we most of the time also do to our patients, you can use a dermo rolling or meso rollers to do the skin care of the head. You can start using them around 4 to 6 weeks after the surgery. Alongside with the dermo rolling, you can use some multivitamin complexes. They're called like Serums or special serums that are used alongside with dermo rolling or meso rollers. And idea is that you don't have to go to the specific clinics or dermatology clinics to get the specific mesotherapy treatment. It's a kind of mesotherapy at home. It's a gentle rolling over the skin of the head with a specific depth of around 1 millimeters that creates a small punch over the skin. Number one, it improves the blood flow. Number two, the vitamin complex and serum that contains vitamins, minerals for the healthy skin of the head and the hair follicles are applied directly to the skin of the head. And because you have that small, tiny holes, the main barrier that avoids a good absorption of these minerals, the skin is eliminated according to the small, tiny holes. Healing goes really nice. The blood flow is improved, and you also get directly the vitamin and mineral complex directed to the hair roots. So that was the main idea of the care of the skin of the head. Before the surgery, after the surgery, and in general. So as a summarize, yes, number one, healthy hair comes from the healthy skin. And you need to do a good care of the skin of the head so the hair become healthier. Any fungal infection, any inflammatory disease of the skin, seborrheic dermatitis, fungal infections, they affect the general skin of the head. After the surgery, the good care, massage, improving the blood flow, getting vitamin and minerals directed to the layers to the lower layers of the skin will help in general health of the skin and improve the growth of the hair as well. Thanks for watching us. If you have any questions, you are always welcome to leave the comments. We will be glad to answer them. Thanks for the watching and stay tuned.